Imagine that a disease has been curable for decades. The medicines exist. Doctors know how to diagnose it. Treatment is available. Yet every year, millions of people continue to become infected, and many still lose their lives. Why? The answer is surprisingly simple. Because many health problems are not only medical problems, they are also communication problems. Hi, my name is John Alanzalan, a Doctor of Communication student at the University of the Philippines Open University and a procurement and supply chain professional based in Sydney, Australia. Today, I will present one of the most influential advocacy, communication, and social mobilization or ACSM programs in the world, the World Health Organization's ACSM program for tuberculosis control. Rather than simply describing the program, I will discuss how communication became an essential strategy in addressing tuberculosis and why this program represents an excellent example of ACSM in practice. Before discussing the program itself, it is important to understand the problem it was designed to solve. As we learned in Module 1, ACSM is more than a collection of communication activities. It is a communication framework that integrates advocacy, communication, and social mobilization to address complex social issues and promote meaningful social change. The WHO ACSM program provides an excellent example because it demonstrates how these three components work together toward a common public health goal. Tuberculosis, or TB, remains one of the world's leading infectious diseases. Although TB is preventable and curable, millions of people continue to develop the disease every year. At first glance, TB appears to be purely a medical problem. However, the World Health Organization recognizes that many barriers to TB control are actually communication related. These include lack of public awareness, misinformation, stigma, fear of diagnosis, poor treatment adherence, and limited political commitment. In other words, medicine alone cannot solve tuberculosis. People must understand the disease. Communities must participate. Governments must prioritize it. This is precisely why the WHO developed the ACSM framework. The WHO Advocacy, Communication, and Social Mobilization program was developed to strengthen tuberculosis control by integrating communication strategies into public health practice. Rather than focusing solely on medical treatment, the program recognizes that sustainable disease control requires coordinated efforts among governments, health professionals, civil society organizations, communities, patients, and development partners. Its overall objective is not simply to reduce tuberculosis cases. Instead, it seeks to create an environment where individuals, communities, and institutions work together to prevent, detect, and successfully treat TB. This reflects the central idea of ACSM that communication is not an optional support activity, but an essential component of social change. The first pillar of the program is advocacy. Advocacy focuses on influencing decision makers and institutions that have the authority to allocate resources, develop policies, and sustain tuberculosis programs. Within the WHO ACSM framework, advocacy includes engaging government officials, legislators, donors, health administrators, and other influential stakeholders. The objective is to secure political commitment, strengthen policy support, and ensure that tuberculosis remains a national and global priority. Without sustained leadership and investment, even the best health programs struggle to achieve lasting impact. The second pillar is communication. Communication focuses on informing and influencing individuals and families. Through educational campaigns, media initiatives, interpersonal communication, counseling, and health education, people learn how tuberculosis is transmitted, recognize its symptoms, seek early diagnosis, and complete treatment. This reflects what we discussed in Module 1 regarding behavior change communication. Effective communication increases knowledge, shapes attitudes, and encourages healthier behaviors that contribute to improved health outcomes. In the ACSM framework, communication empowers individuals to make informed decisions while reducing fear and misinformation surrounding tuberculosis. The third pillar is social mobilization. While communication often focuses on individuals, social mobilization expands the effort to entire communities and stakeholder networks. The WHO encourages partnerships among community leaders, schools, employers, non-government organizations, faith-based organizations, volunteers, patient groups, and local governments. These stakeholders work together to increase awareness, reduce stigma, encourage treatment adherence, and create supportive environments for people affected by tuberculosis. Social mobilization transforms health programs from institutional initiatives into shared community responsibilities. This illustrates one of the most important ideas in this course. Sustainable social change requires collective participation. This program is an excellent example of ACSM because all three components operate simultaneously. Advocacy secures political commitment. Communication informs and influences individuals. Social mobilization builds community participation and collective ownership. Together, these strategies address tuberculosis from multiple perspectives rather than relying solely on medical interventions. As a result, the program demonstrates how communication can facilitate both behavior change and broader social change. It also illustrates that complex social problems require coordinated action across multiple sectors rather than isolated efforts. To conclude, the WHO Advocacy, Communication and Social Mobilization Program for Tuberculosis Control demonstrates that communication is not simply about sharing information. Rather, it is about creating partnerships, influencing decision makers, empowering communities, and promoting collective action toward social change. The program reminds us that successful interventions require much more than technical expertise. They require communication strategies that inspire participation, collaboration, and shared responsibility. As we continue exploring ACSM throughout this course, one important question remains. How do we know whether an ACSM program is truly effective? Answering that question requires a systematic evaluation framework. That will be the focus of my next faculty mark assignment.